Hi, this is Amelia Lyons, Clinical Supervisor Trainer for an Iron Bevan Health Board. Now, I wanted to talk to you about the Tietze Peer Consulting model. Kim Oliver Tietze is a lecturer, professor in Hamburg. He developed this model. Unfortunately, his book has never been translated to English, but the model has been around and used in Britain before now. Now I'm sharing this with clinical supervisors in the health board, but it can equally apply and in fact was born out of a management consulting sort of model. So it makes a change when we see us from the psychotherapeutic side and the health side borrowing from the peer consulting models as opposed to the other way round. So let's take a look at what the model is about. Now he talks about setting the right conditions in place for the peer consulting group to meet, including developing an atmosphere of trust, confidentiality, so people have confidence that what they're going to say won't be shared outside, an atmosphere of support, and general appreciation and respect for one another. He does make the comment that teams shouldn't have any sort of personal dynamics between each other, but of course if you do take this into an existing team that are working together, that's a fairly unrealistic expectation. There will always be existing dynamics between each other, and some of those won't be positive, if you like, but the structure of this model is such that I don't think that matters unless things are very hostile, because the structure is clear, and I think it can operate in most situations. Now he talks about the model as being in 6 phases. Casting the roles, we'll talk about the roles a bit later, but there are 3 main roles in this model. 4 if you want to argue for a scribe. I'd say the scribe is a role that you can take or leave personally, but it's there. So we cast the roles, so everybody in the group gets a role, and the group should be about 5 to 7 people, something like that, maybe 8. The presentation, which only takes about 5 to 7 minutes, that should only take about 5 to 7 minutes. You don't need to prepare for that. In fact, it's probably better if you don't. There's a key question, formulating one key question, and we'll talk about that shortly. A choice of methods, so we have a menu of interventions that we will look at and explore. Then the consultation takes place, and you'll see how that goes shortly. Then there's a sort of conclusion where after the consultation the presenter kind of shares what they've learned and plan to take away, and if you are running a scribe, then the scribe will note that down and give that to the presenter to take away. Subsequent to that, the group may also then give the facilitator feedback on how they've managed the process. Okay, so in the different roles people will get some feedback, and then the group is encouraged to briefly reflect on the overall process before they move on to the next issue. So that's roughly how it runs. So the group size is 6 to 9 people. The cases get presented, so you can do one after another with a break in between as you wish. And as we mentioned before, there are 3 or 4 roles in the group depending on how you want to run it and perhaps the amount of people that you've got in the room. So there are the roles of the consultant. Now that may be 2 or 3 people, so that depends on the size of the group. The presenter, who can only be one person, of course, presenting the issue, the dilemma, the case, the problem. And the facilitator, who holds the group, keeps it to time and manages that process overall. And there's a scribe who would note down the main points of the discussion and the main action points for afterwards. So if you want to include a scribe, that's the job of the scribe. The scribe may also come in and make a comment as well if they're invited. Now each case following this model takes about 30 to 40 minutes with feedback. Now, what Tietze advocates here is kind of quite a focused way into the consultation by trying to identify a specific question that you'd like to explore, so that you can spend a few minutes with the group beforehand looking at that actual question. Is that actually the question you want to ask? So a good supervision question is simple and brief. So one exercise is to actually get the question into 10 words or less. Maybe do that even in pairs before you commence the group consultation. So really thrash out that question. Is that the question that you really want answered? And quite often in that process, it might not be the exact question that you want. So that whole process of focusing helps to hone down the question. So it usually focuses on an aspect of your clinical work, but it could focus on a team-related issue that you find is affecting you, or an issue regarding a colleague, or even something regarding your professional practice and development. So a good supervision question helps to focus the discussion, making it more useful and time effective. Also talks about the fact that it shouldn't be too hot a question. So if you were to rate your question on a sort of an emotional scale, as it were, of 0 to 10, where 10 is very hot, it's something that you feel very strongly about because maybe you've just got out of a meeting with your manager, they've said something you don't like and you're feeling very hot and bothered. And what they argue is that really you should look at something sort of fairly warm, perhaps a 6 or 7 max out of 10 rather than an 8, 9, 10, where you're still in the heat of it and may not be that sort of rational yet about the issue. So now we get to the meat of the model, the menu of interventions. Now what Tietze argues is that the presenter should get the choice of intervention here that they ask the consultants to work out for them. Now I might argue that actually sometimes it might be useful to let the consultants choose and work to their areas of expertise. And it might be a negotiation of both, or in fact that the presenter gets to choose one method and then the consultants get to choose another. So some of it might depend on the topic. For example, let's say I'm saying something about I'm struggling working with someone. I'm not knowing if I'm doing it right. I'm working with a patient and we don't seem to be getting anywhere. So, could I have some help, please? This is what I'm doing. What do you think? If we're looking at, so we might brainstorm a whole range of interventions there to see if, I'm using one intervention, but actually, there might be 3, 4, 5 more that I could think about. The headstand brainstorming is about sort of flipping the question. So somebody might ask me, well, what would a really useless intervention be here? Or what would a really useless outcome be? So asking almost like the opposite, really, of what I'm trying to get at. Or when you say you're not good enough, what does bad you look like? So we get some questions there that throw things on their head a bit and really make me think. If we're looking at role play, let's say I'm talking about, I'm not getting on with my boss at the moment or my colleagues, and I describe a situation where that's taking place. The consultants somebody might identify with the boss or identify with me and kind of play that out a bit. Or I might specifically ask the consultants to, say, do a role play for me. Let's say I want to negotiate a pay rise, or I want to negotiate something different about my job. That the consultants in the group might play out myself, my manager, or some other important stakeholder who's involved. And so that would I could watch that and have a think about, oh yes, different kinds of things that I might not have thought about. Sculpting, that could be, if you've got a big group, you could actually get a group to do a sculpt, and the consultants might take over that, because that might be a bit too much to ask the presenter to do. Although if they're very expert, they might be able to sort of put people in postures and set up a group. in different positions that kind of depict the situation that they're in. Sometimes you might use buttons or other objects, stones, things like that, to depict the situation and invite comment from the consulting group on that and from the presenter on that. You could operate as sort of almost, I would say, a person-centered method of really listening to the individual talk about the story and then simply reflecting back what you've heard, reflecting back accurately and having an engagement with the presenter there, rather like the noddy jackpot exercise of Bridget Proctor and Francesca Inskip there. That's worth doing, I think. Developing hypotheses. Different consultants might have different hypotheses about the situation. So let's say I was working with a patient and I was stuck. Perhaps the consulting group might have a variety of hypotheses as to why the stuckness. Could that be in me? Could that be around the patient? Could there be environmental issues going on that all contribute to that kind of stuckness? Free association, I might think about that as a balanced type of group where somebody describes the situation and then sits back and the group fantasizes and sort of gives dreamy, free associative, imagey type responses to what's going on. Absolutely not trying to problem solve, just offering back pictures that they see as the presenter talks. Mindful awareness replay, so something about getting the presenter to once more go through the problem and actually sharing how you feel in your body in relation to and what you're aware of as the story is being told. Storytelling, now that could be a situation where, for example, the presenter has told their story. And then instead of people responding, what the consultants do is go round in, there might be, say, 3 or 4 consultants, where each one tells a story back to the storyteller. So they pick out something that they resonate with in the story and they tell a story back. So that's not sort of giving advice and saying, well, this is what I did when this happened to me, but it's more like just recounting the story of what happened to you. And what you did in a particular situation, without particularly saying that this is what you should do, but more like saying this is what your story reminds me of, and I'm just going to recount it in the first person. Obviously, you need to keep those stories fairly brief, but they should be self-disclosing in some way. Then you might have art, music, creative sort of non-verbal interventions. One example might be when you shared that story, I felt like this, and you might show a posture. Or you might say, this is the song that came into my brain when you started talking about so-and-so. Or you might say, this is a picture that came into my mind when you said so-and-so. So that might be the interventions. Good pieces of advice. It's funny actually because when I've used this model, quite often the presenter wants a good piece of advice, and then the consultants give them a good piece of advice, and the conversation stops after about 2 minutes. So really that's kind of the presenter wants certainty, the group responds with certainty, and then you just don't get anywhere. There's no exploration that gets done. So it's a real cul-de-sac, that one. I'm not saying there isn't a call for it at some points, particularly when there's ethical issues involved. But nevertheless, I think a degree of exploration is always required. And advice giving tends to stop that dead. Consultant's choice. So you remember at the start of this slide, I said that Tietze says that the presenter should get the choice. And actually, I think that there's a good case for the consultants offering a choice, partly based on the expertise that they've got to offer. So the presenter might say something, might say, look, I want to do free association, and the consultants have never done that before and are a bit sort of nonplussed. Whereas the consultants, I would advise against them going into familiar just for the sake of familiar or just because, they've got expertise in an area. But they might think, oh yes, no, that's the kind of problem that actually playing out a role play might be quite a good thing to offer. So there's something there about that negotiation that takes place between the presenter and the consultants. Now, often this is quite a neat and efficient model, so I would argue that you've actually got a case for doing one of the presenter's choice and one of the consultant's choice, and then reflecting on that and seeing what comes out of it. So I think on choice, which we've already mentioned in the previous slide, there's a place for the presenter and the consultants to have a choice in intervention. Feelings, just noting a kind of general rule of thumb really, that whenever they're mentioned, they should be fully owned by the person, the discloser of the feeling, and not kind of projected onto each other. Sometimes that's more challenging than it sounds. On the group ability, I think a critique that you could usefully level at this model is the fact that, of course, the group much of the time won't be able to or have the capability in undertaking all of those interventions. Some of them require some quite good training there. So I think in general terms, we're looking at commitment to CPD by people who want to use this model, but also the idea of being willing to have a go. For example, sometimes you come across plays where, I don't like role play, and people kind of go into a very conservative, unnecessarily so position in that respect, when actually they might be quite a good negotiator, and it's a real shame that they don't share that skill in the form of a role play and share it generously with the group. So I would invite people working with this model to be willing to have a go and try things out. That's how you learn. Overall, though, I think this is a tight, very structured model that is quite useful, particularly when you're going to a group that you don't know and you just kind of set up a supervision group, perhaps a one-off consulting supervision group, or you may just be starting off with a group. So it offers a comforting kind of structure that people can fit in. It can feel a little crowded, especially when you're doing the timings. There's quite a lot to think about. So it usually takes 2 or 3 goes before you get quite fluent with the model and are able to go through it, easily. So there are pros and cons to using it, and I think the general level of expertise is kind of assumed in that list of interventions, which it shouldn't be, because, as I say, not everybody's got the skills to engage in all of those interventions. But overall, I think this is a lovely, neat little model, and I can't wait for Tietze to get his book translated into English. Thanks very much. So you will find this model on the internet if you look for it, but it's changed places since I last looked. So you've got to use those titles next to me, and you will get there. As I say, we're waiting for his book to be translated.